That's number one. You kind of reset your
Painful, tender to the touch. May also
same shoulder length, and the other. Hey everybody, this is Real Health with Brandi and Amir. I am Dr. Amir Rashidian, a chiropractor. Brandi Rashidian is my other half, and like I said, this is Real Health, where we talk about how to feel better, get stronger, live longer, and feel younger. And what we do is we're going to go over some latest articles as far as what's in the news and what's talking about in health, and we're going to discuss those. So what do you say we jump right in?
I think we should. And this one's I would say is probably the most controversial one we've done so far. What would you think?
Yeah, I agree. So the title of the article, this is from Health News, and the title says, "Doctors call for changes to laws that criminalize drug use during pregnancy. Overdoses are a leading cause of preventable death among pregnant and postpartum women, yet fears of child abuse laws keep them from seeking help." So basically, they're talking about how there are ladies who are pregnant and they're addicted to some kind of a drug, a recreational drug, an illegal drug, and if they sought for help, if they asked for help, then doctors could help them easily. But they don't, because there's laws that call this child abuse. So taking a drug that harms the baby during pregnancy is considered child abuse. What do you think about that?
Man, this is such a hot topic. You know, it is our job as a parent to protect our children at all costs, right? That's what being a parent is. And so I personally can't imagine the dilemma that a woman would feel in having this addiction. And we all, I mean, not everyone knows what addiction feels like, right? Because we hear the term, but no one, unless you've ever had a true addiction, can really understand the pull that has.
It's true.
So I struggle with this because I feel sympathetic to someone who has an addiction and and they don't feel like they have an outlet or feel like they can get help. But I'm also a parent of 3 children, and I wouldn't even take a Tylenol when I was pregnant because I was even if my OBs were like, "Oh, it's fine. They don't get any of that." I struggle with that comment because I go, "Do we really not know what the children are taking in, through the placenta? Do we really know everything that's filtered out?" I just feel like there's so many gaps in our knowledge.
Well, we've seen what kids look like who are born into this world under heroin and cocaine. And we've had multiple patients,
Oh my gosh.
little kids who just have
They just
no
struggle.
ability to control themselves. They have mental issues, almost like they have demons in them. They just aren't able to relax. So this is a story that, I almost think maybe it should be child abuse if they don't seek help.
Yeah.
If they keep it under wraps and just show up to the hospital to deliver a baby and not get off the not get off the drugs and not ask for help,
Right.
maybe that should be child abuse. But this is a story of a lady, same name as you, Brandi. Brandi Williams had been up for 2 straight days smoking crack cocaine when she realized she was going into labor. Treatments for drug addiction during pregnancy are safe for both the mother and the baby, doctors say. Methadone and buprenorphine, for example, can reduce cravings and help users carry a pregnancy full term without long-lasting effects on the baby. So again, that's another one, because I go, well, you're just trading one drug for another, and I guess it's good that that they found no long-lasting effects. It says,
But make note, it doesn't say there are no effects,
right.
right? So it just says no long lasting effects. So I would need to have some of that
Yeah.
quantified,
Right.
give me more.
But if, like you said, if someone who's addicted is in this disease where they absolutely can't,
Yeah.
it says, shame and stigma, the same that Brandi Williams felt, stop many pregnant women from seeking help. A bigger deterrent, however, is the crippling fear that their babies will be taken away by state welfare. So substance abuse during child abuse is considered deserves criminal prosecution, they say. We should remove criminalization of women who are pregnant and taking drugs. Dr. Nora Volkow, head of the National Institute on Drug Abuse, said in an interview that needs to stop, she says. So I don't know if that seems too simple. I don't know if it's going to solve anything. Is it going to encourage more people to say? I wonder, what I would like to know is, I wonder how many women find out they're pregnant and use courage and willpower to stop and detox themselves, or immediately go to a doctor and say, I need to stop taking, I am pregnant, I want my baby to be healthy.
Right. The challenge is a lot of times when there's an addiction that is, they're in so deep into that addiction, sometimes they don't even know they're pregnant, which I think, according to this article, is what Brandi was experiencing. Is she didn't even realize she was pregnant.
Yeah.
Through this addiction and through that drug use.
Right.
I think that these are never black and white. I think that this is more about what program has been created to take these women when they actually come and say, hey, I have a problem and I want my baby to be okay. I would never want a woman like that to be ostracized,
Right.
or
lose
for
her
us
child.
to turn. We need to partner with them and say, let me help you. Here's a program that
Right.
we can put you in. We'll teach you how to care for your child. We'll help you with the addiction. So I don't think it's just about the law.
I think the law shouldn't be black and white.
I agree.
There should be gray shades of gray in the middle. No pun intended.
Watch yourself.
Let's just wrap this one up. That's a funny one. Don't edit that out. The rate of women with opioid-related diagnoses at the time of delivery increased by 131% from 2010 to 2017, according to a 2019 study. And the number one cause of preventable death among pregnant and postpartum women in particular isn't pregnancy related at all. It's drug overdose. A couple other things. According to a study published last year, the number of pregnant women and new mothers dying of drug overdoses reached a record high in 2020, 11.85 per 100,000, up from 6.56 per 100,000 in 2017. So from 2017 to 2020, the number of women dying of overdose, pregnant women dying of overdose, doubled.
Well, let's not be surprised. We all know what was going on, and our country and our homes were a mess in a lot of cases.
Right.
Right. And so I think if we looked back, we'd probably see a lot of things at an all-time
There was this silly
high.
virus. What was it called again?
I don't remember.
Some silly. It had the name of a beer. Or was it
Yeah, something
Corona?
like that.
Corona. It's a virus called Corona. I don't know if anyone's heard of it. In 1974, Congress passed the Child Abuse Prevention and Treatment Act, known as CAPTA, CAPTA. It requires states to have a plan in place to address and respond to child abuse and neglect. It included babies born affected by drug withdrawal. So I think we've decided that we don't know the solution, but
Yeah, I mean,
but
it's
there needs
hard.
to be
But I think we need to encourage women to seek help no matter what.
Right.
Because if we know what those stats say, their life and the baby's life is more important than anything else. And so regardless of what the consequences could be, reach out and ask for help. It's out there.
Yeah, and the study goes on to talk more about this, but I think that's the main issue. Williams, now age 40, got sober in 2021 with the help of Suboxone. Williams has a steady job and is pursuing a degree in psychology,
That's
so she
awesome.
can one day provide substance use counseling to others in need. So this story definitely had a nice, happy ending. The next article is called Type 2 Diabetes, How Exercising in the Afternoon Can Provide Benefits. So researchers are reporting that people with type 2 diabetes may reap more benefits by exercising in the afternoon. In a new study, the researchers reported that participants who exercised later in the day achieved better results in terms of blood glucose levels. They They said they aren't sure yet why afternoon exercise may be more beneficial, but it may be because of better sleep patterns and healthier eating habits.
I I would have a hard time correlating that to the morning versus afternoon. I think regular exercise is going to help with those things no matter what. So I would be interested to see why they're correlating that to just an afternoon workout. Now, the benefit is the gym is usually way less busy in the mid-afternoon. So that's a plus. We could go with that.
That's true. That's true. And it doesn't say when in the afternoon. So what time is afternoon? I mean, is it like 12:01? Is that considered afternoon?
Now, I think most consider like the 12:01 to I would say 4. That would be afternoon.
Between
for me.
12 and 4. Now, I know hormonally speaking, you're strongest between 10 a.m. and 2 p.m.
Well, that's interesting.
So if you're stronger, maybe that's one of the reasons you get more benefit from. Now, I'm talking mainly because we work a lot with bodybuilders and
Mhm.
powerlifters and so on, and it seems like that's the ideal time to be able to pick up the most weight.
Right.
So,
Interesting. Well,
uh,
we know that there's a lot to some of those cycles, right? Like when you've done a lot of research on sleep, sleep is very important to him.
that's right.
Matter of fact, he naps every day. He's a big napper. And we encourage our team to nap as well. That's super important. How many bosses do that, right? Now I'm not going to pay them to nap, but I definitely encourage them to do it on their time off.
It's a 10-minute vacation.
That's right. But sleep is the same way, right? When we
hmm
were working with the police officers at the police academy years ago, we kind of laughed about it and made a joke about, criminals are out at a certain time at night. Well, we also know that the body goes through healing and repair at certain junctures in the day. So, there could definitely be something about the working out in the afternoon.
Yeah. I don't think the article says how much it reduces blood glucose. So they measured blood glucose, but I think the biggest part when it comes to type 2 diabetes isn't how much sugar is in your blood. I think it's how the insulin's working and how much insulin resistance you have.
Hmm.
So I think they should have measured insulin as well. Does insulin get released or not? But so they looked at 5,000 individuals with type 2 diabetes who were classified as overweight or obese. Researchers determined that those who engaged in moderate to vigorous physical activity in the afternoon had the greatest reduction in blood glucose levels after 1 year. Afternoon exercisers also had the highest odds of stopping their glucose monitoring diabetes medications. 3 years later, the researchers said those who maintained their regular afternoon workout regimen maintained a reduction in blood glucose level.
Interesting. So it wasn't just after 1 week. This is also sounds like there's a cumulative effect.
Yeah, and type 2 is the most common type of diabetes.
Hmm.
Just for our audience, type 1 is juvenile diabetes, juvenile
Right.
onset, and type 2 was called adult onset diabetes, and that's changed.
Right.
And the reason they
Interesting.
changed it is because it's not just adults who get type 2 anymore.
Right.
Kids are getting it.
Yeah, so let's talk about that
Mm.
because juvenile diabetes, right, is they were born without their
Not that
pancreas.
they were born. Something triggers an autoimmune response
Okay.
where the body attacks the beta cells in the pancreas,
Okay.
and then the pancreas stops producing insulin, so they don't make any insulin.
Okay. So they have none
They don't have
being
insulin,
produced.
so that's why their blood sugar goes up. So typically it's adolescents, teenagers. Suddenly they start losing weight, hungry all the time, urinating
Thirsty.
all the time, thirsty all the time. Right? And the more they eat, the more they lose weight, and
Yeah.
obviously that they find out that they're diabetic and they are insulin dependent. So that's another name for type 1 is insulin dependent
Right.
diabetes.
Because their body is not producing
It's not
it
producing
on
any
its own.
insulin, and there's no going back. Once those beta cells are destroyed, there is an herb called gymnema that's been shown in laboratory to
Hmm.
regenerate beta cells in the pancreas.
That's
So
interesting.
it's very cool. But I don't. I mean, if it was that powerful, we could eradicate type 1 diabetes. We haven't. So,
Right.
but I think people with type 2 diabetes have benefited from taking that herb. But
It's actually a really cool herb too, because if you take the liquid form
yes,
and then you taste something sweet, it'll taste sour.
yeah. If you put it on your tongue, yeah. If you take gymnema, the liquid gymnema on your tongue, hold it in your mouth for about 10 seconds, swallow it, and then you put chocolate on your tongue, you don't taste the chocolate.
Yeah, it's like a really fun party trick if you ever want to try it.
Yeah, you
So,
can't taste sweets. It basically numbs your sweet taste buds
yeah.
for an hour or so,
Yeah,
or
it's
half an
really
hour.
fascinating. So some people do it too, not just to help balance.
Get rid of cravings.
Yeah, it does. It gets rid of cravings, and it's really fascinating.
So that's type 1. Type 2 is when their pancreas is producing insulin, but their insulin receptors are not responding to the insulin. It's called insulin resistance.
Gotcha.
Some people, there was a time we used to call this syndrome X because it was related to people who were overweight. But that's changed too,
Yeah.
because a lot of type 2 diabetics are not overweight.
Mm-hmm.
And I believe it's because they don't handle stress properly. So cortisol levels go up. Their cortisol goes up. Glucose in the blood goes up. Even if you're fasting, did you know this? You get upset. You
did
get
not.
angry. Your body converts the fat into glucose, called gluconeogenesis, and then glucose goes up. And so even though you haven't been overeating and you don't eat a lot of sweets, you still release glucose in the blood, and it gets too much, and the insulin receptors start to get dull. So we even have a couple of friends they're not obese,
Right.
but they're I should say high strong. Is that a good word? Like they get angry easily, they get
They've
emotional,
got big personalities.
big personalities. Yeah, and they suddenly became type 2 diabetic, even though they're not overweight or obese.
Yeah, that's
So,
fascinating.
so it's resistance. Now, think about this: case of type 2 diabetes, and I wrote about this in the book. Type 2 diabetes, the cases beginning in 1991 tripled. New cases year over year tripled. Every year was 3 times more than the year before, beginning in 1991. So what happened in 1991
Well,
that
let's
started all
let's
this?
give the audience a minute or two to think about this. There was actually things that happened newsworthy, right?
Yeah,
That changed
yeah,
changed our food
yeah.
sources.
I mean, and I'll go back a little bit. In the 80s, fat was the evil.
Oh, yeah.
Right? They said fat is bad. Fat causes heart disease.
Yep.
When they took fat out of the diet, everything became fat free. I don't know if you guys remember in the early 80s,
Low fat, no fat.
the rice cake was invented.
Oh, yeah.
Everyone said rice cakes are great because they have no fat, and people
Right.
got fat. In fact, obesity shot up the minute everything became fat free because
Yeah.
people ate more carbs. I'm not saying carbs are bad. Don't get me wrong. Everything's good. So then in the 90s, what happened? They changed their stance. They didn't say fat's bad anymore. They said, well, we found out fat's not bad because when we took fat out of the diet, heart disease and obesity went through the roof.
Right.
So then they said it's got to be the sugar. So they took sugar out. So what was invented in the early 90s?
Well, it were all the artificial sweeteners.
Yeah, artificial sweeteners, fat-free soda. Sugar-free sodas. Is there fat-free soda?
No.
I think all sodas are fat-free. There's no fatty sodas out there unless you drink bulletproof coffee.
And that's
but
not a soda.
that's not a soda, right? You can carbonate it, maybe. I don't know. That would be weird. Get back on track
That's why
here.
he's not allowed in the kitchen.
I can pass through. I'm not allowed to stop.
That's right.
So, but yeah, sugar got taken out of these drinks. So here's what happens. The minute your tongue tastes something sweet, your brain assumes sugar's coming in. Your brain tells your pancreas, release the insulin. All this insulin gets released into your blood and goes and knocks on all the receptors of your muscles, because your muscles and your liver have insulin receptors. That's the main area, because sugar needs to get pulled in. Glucose gets pulled into your liver and your muscles, gets stored as glycogen. And then when the glycogen stores are full, the rest of it gets converted to fat. So insulin does all of that. But what happens is insulin gets released when you drink something sugar-free. And
'Cause
then
it's sweet.
Yeah, because it's
right?
sweet. So the brain thinks sugar must be coming in. I just tasted it. It's very sweet. And so it knocks on all the receptors. The receptors wake up. They look for sugar. There's no sugar. Next time they get a knock from the insulin, they ignore it.
So I think this is kind of that old story of Don't Cry Wolf.
Yeah,
right?
the boy who cried wolf. That's right.
So crying wolf can lead to diabetes.
Yeah, so that's the problem. And in fact, that's why since 1991, type 2 diabetes has been on the rise, and it keeps increasing, getting worse, because more people, and unfortunately a lot of experts, I don't know why, they tell people if you have diabetes, you got to have these sugar-free stuff. I don't think that's the answer. The answer is here. Exercise. And if you really want to do it right, do it in the afternoon.
Yeah.
I guess so. I mean, 5,000 people got good results. So that's our little summary on type 2 diabetes. And the article goes on, you alluded to this a little bit. Exercise is going to be beneficial no matter when you do it.
Yep.
You have to take into account your circadian rhythm, your cortisol cycle. Cortisol should be high in the morning. That's why you wake up. Cortisol starts to build up through the night. When it's highest, you wake up. In fact, cortisol is highest roughly 45 minutes after you wake up.
Interesting.
So cortisol is produced by adrenal glands. Adrenal glands also produce adrenaline, testosterone, estrogen, progesterone. A lot of these hormones are also produced. Now, I know the ovaries and testicles produce those things as well, but the adrenal glands also produce those hormones. And cortisol is the one that wakes you up and keeps you awake. And it dips around 4 p.m. And it's supposed to continue to go down to the point where it's near zero and you fall asleep. So if your cortisol levels go up, so some people, when they exercise too late in the afternoon, evening, let's say after 6 p.m., they get a spike in cortisol because exercise is a stress on the body. Stress causes release of cortisol. Those people have trouble bringing that cortisol back down to go to sleep properly. They may not get enough out of their sleep.
It's interesting. I would love to know, and this is a top question for another day probably, but I wonder how cortisol then plays into new moms, right? We just adjusted a 6-day-old today, cutest little thing. Oh my goodness, she's adorable, Gigi. That's my nickname for her. So we adjusted Gigi today. Little girl holding her head up, just so strong. But I think about that with moms, right? Because new babies, we're waking up all the time. So does our cortisol level never fully go to zero, or does it go down enough but maybe not all the way? I just wonder how much of a contributing factor this is. Totally, I don't know why it came to my head, but yeah, I would love to know where
That's a
that
good
is
question.
with
I think there's a
new
lot more.
moms.
There's other factors that are
Oh, I'm
involved.
sure.
You know, a new mom has lots of different hormones.
Yep.
One being oxytocin
Yep.
in their body. There's another one that I can't recall right now, but it has to do with the mammary glands and so on, and lactation, and it's possible that their cycle just speeds up.
Oh,
Instead of being on a 24-hour cycle, maybe they go on to like a 4-hour cycle. And they go through these cycles where they nap through. I couldn't do it. I know when we had our kids, you handled sleeplessness better than I did.
Right. Well, but my body had been preparing for it,
Right,
right?
right.
You guys don't prepare for that
Right.
stuff. So,
Although I'll tell everybody, right after when if you're a male and you just had a baby, not, if your wife just had a baby.
thank you. Stop taking credit for our hard work.
So for the first couple months of a new baby, the father has higher testosterone levels.
Really?
And I believe it's some kind of a defense mechanism where the dad says, I need to protect this baby.
Interesting.
And so it increases testosterone. Just like in young boys, when a little boy says, I win, let's race, I'm the best. Every time they say, I win or I'm the best, there's a spike in testosterone in the boy's body.
That's fascinating.
It is. There's certain postures you can stand in that increase your testosterone levels as well.
Yeah.
So, and that probably should be a talk for another one. I want to make sure there's nothing else in this article that we want to talk about. Just please, if you're pre-diabetic or you have type 2 diabetes, exercise when you can. And exercise in the afternoon is best, according to the article. There's a type of exercise created by Dr. Zach Bush. He's a medical doctor. He's very holistic. He understands wellness pretty well. It's called the 4-minute workout. And he says do this 4 times a day. It only takes 4 minutes. Look it up. It's on YouTube. Just search for the 4-minute workout or Zach Bush 4-minute workout and do. I've done that sometimes. It literally depletes your glycogen levels right before you eat, so that when you eat, the glucose in your blood goes into your muscles and liver, not convert it to fat. It's pretty neat.
Well, and another thing, if you think that you may be pre-diabetic or you're experiencing some of those symptoms, now obviously you want to check with your physician and get that checked out, but there are also things you can do at home to be monitoring those things. And we know and we really advocate knowledge, right? So the more you know about your health, the more you can do things at home to test. It is your health. So you need to be the one in charge of that. So they have plenty of things that you can do. We use a Keto Mojo.
Keto Mojo is a great device. I check my
Yeah.
blood sugar once a week, fasting blood sugar every morning. Now, if you really want to know what's going on, if you're kind of concerned and worried about, I wonder if I'm creating diabetes or whatever, check your blood sugar fasting first thing in the morning before you eat anything, before you drink coffee, before you do anything at all. Check
Before
your blood sugar.
Really before your feet hit the floor. It needs to
Ideally,
be
yeah,
as soon as
a-
possible.
and that's one. Then check your blood sugar every 15 to 20 minutes after a meal. And let's see what happens. Let's see how fast it goes up and how fast it comes back down and how low it goes. Because ideally, throughout the day, your blood sugar should stay level. And in fact, our next article is from USA Today, and it's called "How to Know If You Have Diabetes." Here's a look at early signs and symptoms. And but I think we already talked about some of this. Is throughout the day your blood sugar shouldn't go up and down. One of the signs is when you get hungry, if you feel weak, you're not healthy. When you get hungry, you should just feel hungry, but you shouldn't feel weak because there's enough stores of glycogen throughout your body to sustain you for 3, 4, 5, 8 days.
Interesting.
So if you get hungry, you get emotional, you get hungry, you get weak, you get hungry, you get lightheaded, you're not healthy. Please remember that. Let's figure it out.
There's got to be
find a
something
way.
that's interfering
Yeah.
then.
Hypoglycemia is just as bad as hyperglycemia. Hypoglycemia is when your blood sugar tanks. Also has a lot to do with sleep. People wake up in the middle of the night and can't fall asleep again. That's a blood sugar issue.
Interesting.
People urinate a lot through the night. That's typically a blood sugar issue, or it means you're eating too much food. You ate too many carbs that night before you went to sleep. So, this article, like I said, is from USA Today in the health section. It says more than 1 in 3 Americans have prediabetes. That's scary.
It's a lot.
1 in 3. I mean, there's 8 billion people. That means 2.5 billion of them. Yeah,
It's astronomical.
almost 3 billion people. Well, in America, it's 300 million, 350 million. So you're really looking at 110, 120 million people just in America.
What I'd like to know is really what are the stats for US versus other countries? Because we know that unfortunately we do not live in the healthiest country. So I think if we broke it down.
The CDC says more than 80% don't know they have it.
I believe that.
Here's a look at the early signs and symptoms of diabetes. Symptoms are typically slow and insidious. Each year, 1.4 million Americans are diagnosed with diabetes, with type 2 accounting for up to 95%. We just say everybody's type 2 diabetic. 95% is close to 100. And so, yeah, I think you're right. Polydipsia is a word for increased thirst. Polyuria is frequent urination. Polyphagia, I think, is another word, means hunger. They're hungry all the time. Extreme fatigue. But yeah, if you find you're losing weight, you're always hungry, you're always thirsty, you're urinating more often, get checked. And there's a whole lot more signs that you can look for, like yellow, red, or brown patches on your skin, darker area of skin that feels like velvet, hard thickening skin, blisters, skin infections, open sores, and wounds. So when a cut doesn't heal, it's because there's
Right.
too much sugar in your blood. Bacteria love sugar. And so frequent yeast infections, things like that, skin infections, open sores, we talked about that, shin spots, small reddish yellow bumps, red skin colored raised bumps, dry or itchy skin, yellowish scaly patches around your eyes, skin tags. I have a stinking tag. What are we going to do about that? I hope I don't have diabetes. I know I don't have diabetes. So my point is, don't freak out. You hear some of these, you go, I have that. Oh my gosh.
We were
You know,
just talking about
when-
this with somebody
when,
the other
when,
day.
when I was in chiropractic school, you take like years of pathology and you study all the diseases, and sometimes you study the rarest diseases. But the funny thing is, when you study a disease, you start to manifest those symptoms in your body.
Yeah.
I think I've had PMS. I've had MS. I've had, every STD. Even though I've never had STD, I feel like I've had them, because you study these things, you start to feel I used to go to my clinician all the
This is a
time.
dangerous conversation for somebody to just walk in
Yes.
on a small part
Oh
of.
yeah, I know. Well, risk factors: being overweight, being 45 years or older, having a parent or sibling with type 2 diabetes, history of just, but there's no direct hereditary link. So I think it's more social heredity. If the parents have bad eating habits, poor exercise habits, kids have the same thing. We make our kids exercise. Well, I mean, we don't have to make them. They just see us exercise and they want to do it.
Yep.
Our 6-year-old is on a quest to build a six-pack. History of gestational diabetes. So that's during pregnancy. If someone has diabetes during pregnancy, they're more likely to get diabetes when they get older. Giving birth to a baby who weighed more than 9 pounds, even the baby has higher risk of type 2 diabetes. Having
Interesting.
polycystic ovary syndrome. Now, PCOS is usually because of blood sugar fluctuations and insulin fluctuations. So you get your blood sugar under control, those cysts actually go away. So anyways, I think we've beaten the diabetic horse to death. And bottom line, guys, your blood sugar needs to be stable. Get it checked and tested. Exercise regularly, daily if you can, but it can be simple. You can go for a walk. Lifting weights is good. It does increase sensitivity of insulin receptors. Very, very important.
There's great supplements that can help to
Absolutely.
to help regulate and
Yep.
and
When
help
it
you
comes
get
to
out
those
of those.
supplements, though, I'd like you to be under supervision of someone who knows what they're talking about. A naturopath. It could be a chiropractor who's studied this stuff in detail and knows what they're talking about. It could be an endocrinologist who understands supplements. Unfortunately, a lot of endocrinologists don't understand supplements. Medical doctors rarely study supplements. And this country, the FDA doesn't regulate supplementation, unfortunately. So that causes a problem as well. Other countries do. And so the doctors are trained in it. In fact, side note, our medical doctors today, you're looking at primary care doctors to all the specialists, they get zero training on over-the-counter drugs as well.
Wow.
Their training is strictly on prescription drugs. And so they don't look at over-the-counter stuff. Yet I know several thousand, I don't want to quote the number, but it's several thousand people die every year because of livers shutting down and kidneys shutting down from over-the-counter anti-inflammatories, painkillers.
Yeah.
So we want to be really careful with that. So anyways, I think this was a good show. We talked about diabetes and drug use during pregnancy, and hopefully you
Yep.
got some value from that. Tune in to the next one, please. Meanwhile, if this is good, please subscribe and hit the like button,
And even
comment.
share it with a friend.
Yeah, share it, especially people who don't exercise in the afternoon.
That's right. They could use that information.
All right, good show.
Let's go work out.